Same-day teeth, what that actually means. The journey for the Teeth in a Day procedure starts with a 3D facial scan to where you can see your face, but with a wax up, a digital wax up, superimposed teeth that are ideal, and you get to critique that and give us feedback. From that, once you give us the approval, we have the anesthesiologist scheduled, we bring you in, we meet, you go to sleep, and you wake up when we've taken the teeth out, we've put the implants in, and we are printing the 3D teeth, the final teeth right there, a final design of the teeth on a 3D printer. You walk out that day with permanent teeth on those dental implants, and because they're connected together, they function as one unit. That's how we can put an arch of implants in, let you leave with permanent teeth, where a single implant, we still prefer for that one to heal. Unless it's a front tooth, we'd rather that implant heal, then place a tooth on it. But because they're all connected together, we know they're going to function as one unit. We have you eat a soft diet for 3 months, but while that 3 months is occurring, your body is grabbing onto those dental implants. Once it does that, we go from our printed bridge, the exact same bridge that you've made little adjustments to that are pleasing to you, and we make it out of zirconia. Super hard, feels like teeth, strong as ever. That's one option we have. We have another material option as well for those that like something a little different that has some flex to it. So no matter the bridge you choose, about 6 months from start, you're gonna have permanent teeth the entire time that do not come in and out. You can eat a meal the entire time, that you can just not crack walnuts with it, but you can eat anything you want basically. And you're gonna have this transformation that occurs from these badly broken down teeth that you walk in with to this new you. Maybe it's the old you, maybe it's what you used to look like, or maybe it's a smile you've never seen before on your face.